So today's kind of interesting. First, the housekeeping note is I sent you all that, just a group email that I did for the morning group and for my advanced phys, because tomorrow is this Blackboard exam day. I'm interested to see how it works out. I have done Blackboard exams before, but this is my first Blackboard Ultra, and I hope it works as it is. So I may selectively ask any of you to see if at least it's appearing. You don't necessarily have to open it until you're ready. But if I might send somebody a text, not like an email, say, hey, do you see it down at the bottom of your Blackboard? Because I'll see mine, but you won't necessarily see yours or anybody else's. You're there. Just gotta put it away. They're having my family. We have like this group text thing that just everybody has to comment. You feel like I didn't say ooh ah to the picture I just showed you. It's something wrong with it. Oh my goodness. But I digress. So that's the first thing. And like I said, once you open it, that's when the clock starts to tick. So you do have to be aware of that. If there's a problem with it, I gave you my cell number. If there's some issue, don't hesitate to text me, but let me know who you are. Because I won't have it. I have so many people, well, I can't open this. Well, who are you? Because I have 3 different classes are going to be doing this. And I don't know any of the numbers. So that's the point of this. And I will direct you where we ended last time. And this is where you'll find the content. If you want to take a look at it yourself, I added it maybe yesterday sometime. This chapter 25 lecture PowerPoint. This is from Nestor. We're really doing, I still feel it's a skin disease. And originally, this is about Lyme disease, where we kind of left off. If you remember, we left off, we had just finished with their last 2 that they had in the PowerPoint that we were using here, anthrax, and prior to that, Rocky Mountain spotted fever. The reality is Lyme disease was always the one after this. But so that happens to appear on this other PowerPoint, the chapter 25, and it's very, very useful. I don't include all of this information, even though there's some really significant diseases that you'll find here. We had discussed mononucleosis. Technically, it's classified this way if it's immunological in nature. If the primary area that it impacts is, let's say, lymph nodes, like mononucleosis does, or if it sort of makes its way into a lymph node. You see, prior to this is plague, which is an extraordinarily famous disease, and one we see very, very rarely now because we know it's spread. And there's an old saying, control the vector, control the disease, and it's very apropos about what we're going to look at next, which is Lyme disease. And you might recall the frame that I gave you about this is really important. And after I do the presentation on Lyme disease, I'll tell you about two cases. One that was fairly easily recognizable, and the second where I was at fault to a limited, but still at fault for prejudging somebody who came into my office. And, and I think that's a real issue for anybody, whether it occurs in life or for many of you going into clinical careers. You have to take people at face value and understand that it's wrong to look at somebody and say, aha, this or that, and not accept what they're saying to you, because you can fall into that trap. An experience is a great teacher, and this was an experience that really framed that for me, made it important to me. So that's where we're jumping off point today. So, okay, Anna, you're supposed to remind me, did I start recording? I did start recording. Good. See, again, now that I showed you a little red dot, we have to do that here. I digress. Okay, here we go. Lyme disease. Interestingly enough, it says it all in this particular bullet point. This is about 8-year-old information. So there's a lot more cases now. Most common vector-borne disease in the United States by a significant margin. And that's talking about affecting us. It affects animals as well. The dog we had previously, the dog we have now. Incidentally, we took him into a vet because we're having a heartworm screening clinic, and they were testing for heartworm and Lyme disease. Oh, he's negative for heartworm, but Lyme disease. Thankfully they caught it early and they just treated him with antibiotics, and the dog was fine. Okay, he didn't, when he eventually succumbed to illness, it had nothing to do with the Lyme disease. This was something we really were very unfamiliar with. When I was learning about this in my microbiology course, this is what it was described to us as. This is something called tick paralysis. That's all they knew about this. They knew that tick bites had significant problems and frequently were associated with a paralysis that affected the nervous system and muscles and was very painful, though it didn't occur all the time. That's about what we learned about this. And I'm telling everybody here the same thing I told the other group and anybody else who would listen over the years. We are right here in Lyme disease central. We have the combination of, and you'll see the area that it's prevalent in here. And you see how little these guys are. Look at all these areas. What makes them so prominent is the fact that it's carried nearly all the time by something called the deer tick, which is associated because of their life cycle with deer, particularly the white-tailed deer that we have here all the time. And then you bring that along with swampy water areas. That's where ticks breed. Ticks breed in area. If you go hiking or walking, and it doesn't have to be necessarily low-lying areas. I grew up as a kid in New Jersey. We have all low-lying areas. But when you go into the areas we have here, there's plenty of these little, they're really not streams, they're more like ponds. They have that green kind of stuff growing on them. You can hear all sorts of insects buzzing. This is a tick area looking to happen. So we have the confluence of those two factors. A significant animal that's part of their life cycle, where the ticks, and their name for that particular, we call them the deer tick. It's not the only tick, but the vast majority of the times. And so this is really a significant problem that's associated. How do we come to recognize it? This, and I believe it was a physician, a cluster of cases in the 70s. I was educated about this in 1974. So we didn't even know about it. That was there. And it was certainly widespread before then. And so what happens then, you're going to see this is caused by a spirochete. It's caused by a gram-negative spirochete. So a lot of the problems with gram-negatives, remember, they are inherently toxic. And this goes through the bloodstream and provokes a very significant immunological response. So remember what gram-negatives are when they get into the bloodstream, they have that lipopolysaccharide outer layer that's inherently what we call an endotoxin. And so that's a large part of the process. That's why now it's classified as immunological, even though its major manifestation is in skin. And it comes in 3 stages. It has an early stage, and it's highlighted by, but it doesn't always occur, this is what they call a bullseye or a target rash. It's got a very famous name that it was described as first: erythema, which is redness, migrans for migrating. And it kind of goes out in a pattern centrally, going out to the periphery. It sort of radiates out in all directions. So the initial inflammatory area is here centrally, and as it begins to clear, then we see another area, and then clear again, and then another area. So usually you see this kind of a rash. It's very distinctive. The trouble is we don't always see it, because ticks, when they bite you, they typically go to areas which are comparatively dark or have a fair amount of hair or are moist. Most of the times you see them like you see here. I'm assuming this is a sleeve, and we're going up toward the axillary area. When I have seen them, they're usually up in the thigh, typically as the thigh is going toward the groin. That area, think warm, dark, moist areas, frequently with hair. One of the students leaving the 9 o'clock class said that she happened to comment as we were leaving. She goes, we were out hiking, and one of the guys we were hiking with, we had a tick on his neck. So under the collar line, hair, all those types of things that are there. And so that's why they're not always identified very easily. By the time somebody notices them, they start to fade. Oh, I wonder what this was. I must have bruised it, and there you go. The problem is, a lot of times that's asymptomatic. When it's asymptomatic, we don't notice it. Or if it bothered you a little bit and you saw it and it went away, oh, all gone, it's all better. That's very often, it's that out of sight, out of mind thing. Moving on, okay, After that, what it has started to do is now it has started to eventually enter the bloodstream or the lymph and go to lymph nodes. And the lymph nodes begin to enlarge as they begin to develop an inflammatory response to this bacterial invader. And it's very non-specific. So if you haven't noticed the rash, you might just associate, oh, I got some kind of a flu bug. Typically what I would call generic symptoms that are, quote, flu-like. Chills and fever, which can sometimes be pretty significant, but a lot of times they're a little more innocuous than that. Just sort of non-specific, a little bit of fatigue. That's the early stage. And then that goes away. And what happens now this bacteria, which is growing and developing and multiplying in your lymph nodes, gets into the bloodstream and disseminates. That's a fancy word for it spreads all over the place. And notice there's a time lag. You're going to see we're going to talk about a very similar anatomical bacteria which is also a gram-negative spirochete, known as, and very famously, one of the most famous diseases of all time. We're going to go into it next week in genital urinary diseases, called syphilis. And it too has 3 phases and a lot of problems that are associated with it. Interestingly, they're both spirochetes, and they're both related to immunological activity, though that is classified as a genital urinary disease, not as a skin disease, because it really doesn't have a lot of manifestations other than one area on the skin. Moving on, which is phase 2. Phase 2, throughout your system, immunological response principally affects the nervous system, potentially the heart, but these things: spells, fainting, paralysis, headaches, pain when moving, emotional instability. And I'm painting this picture because when I tell you about the case that came after it, it's going to start to make sense. All of this numbness and pains. And then as it goes on, if it goes untreated or unrecognized, then not only do you see skin rashes, but you can persist for a long period of times, but often these things persist, where you can get intractable pain, problems in the neuromuscular system, the nervous and the muscular system, potentially paralysis, significant long-term problems. And I told every class the same thing. I went to my 40th high school reunion. You always see, and unfortunately, there was a picture, like a poster they had on on an easel to show us. We lost about 16 people in our high school class, and one person was sort of in our orbit. The group of friends we always hung out together and did things with. And I asked my buddy, who was the class president, had something to do with the organization of this get-together. I said, "What did she die of?" I mean, we were in our mid-50s at this time. We weren't even 60 years ago. She goes, Lyme disease complications. And I grew up as a kid in New Jersey, so that was certainly one of the areas where, and I don't know if she still lived there or not. But I mean, it's all of a sudden that kind of that clicked with the anecdote I'm going to tell you afterwards. Here's its name. Typically, they name them after themselves: Borrelia burgdorferi, gram-negative, microaerophilic. So it's understand these are hard to grow, but thankfully, if they're recognized early, hard to grow things are relatively easy to take care of, to kill with antibiotics. So a relatively straightforward antibiotic like vibromycin we discussed, which is a tetracycline, okay, is very, very useful for these particular cases. Okay, the fact that there's plasmids with genes are potentially there, identify it. Typically, again, infected tick, migrate out. This is the circular fashion, that lipopolysaccharide layer. That starts the inflammatory reaction. It may even generate a full-blown autoimmune response. I suspect that's the source of a lot of the fatalities. The immune response is certainly part of that, those second and third stages. And you're going to see when we look at syphilis next week, the same is true. We are an accidental host because the ticks are seeking a blood meal. This is why when you endeavor to understand how things spread and why certain diseases spread a certain way, we look at what's spreading. In this case, we can look at the life cycle of the tick. So several species, but the vast majority of those are the deer tick. It's got a great name, tick stew. You don't have to know it. Ixodes scapularis. I mean, if you Rocky Mountain spotted fever, I just love to memorize the name. Dermacenter andersoni. It's got another great name that's associated with it. Look how tiny that is. And if you did not know, maybe you have an animal with a tick. They are very hard to get off. Most people, oh, there's this bug on here. It's like you go with a mosquito and kind of flick it off. It doesn't work. The head burrows. And so you can smack it and try to, but if you don't get that head that is burrowed, it's still going to be, even though it's going to die because of what you did to it, as long as that is attached, it's still giving off directly into your bloodstream these tiny spirochetal bacteria. So, I mean, you can probably find them anywhere, not just a pet store, Walmart, certainly online. These little tick removers are little plastic. They go around the head, and you sort of just, because we did this, one of our cats had it, and you just see the tick is there, you put it on there, and you sort of twist it around, and it basically separates it. Okay, so it's always a kind of, they showed us how to do these in the emergency room, and I mean, people used to like use kerosene on them and different stuff like that. Not very efficient, but there's a way in the emergency room that you'd have to almost pry them out with a tiny sterile scalpel. So they're nasty, and those little appendages stick in. And you can see how small it is compared to the size of a paperclip. This is what I mean. 2-year cycle. When the ticks are born initially, when the eggs that the female beg your pardon, that the female lays drop out, these tiny eggs, the little larvae, they end up an initial host. It's typically a mouse or some type of rodent. Most of these are already infected. They seek a blood meal. And during that first year's life cycle, then eventually they enter into that larval stage. And so in the second year of this 2-year life cycle, we begin to see the nymph. The nymph now has the appearance, rather than the nondescript larva, has undergone that typical metamorphosis, shape change. And now we have the tick. And now this nymph-sized tick are the ones that transmit it. Once they're born, once they escape from the larval stage and change, they're hungry. And they're looking for a blood meal. They're already infected. So they may continue to reinfect more rodents, or they may look at something as an alternative blood meal that's walking around in the nice weather. Because this is not something you're going to see in the middle of winter. We are entering tick season now. Prime season, according to this PowerPoint, May to November, probably starting now about mid-April, sort of in early spring, depending on just how it's been fairly warm of late, all the way until maybe you've had a good couple of frosts in November. People mistakenly say, oh, you get this during hunting season. Well, hunting season around here, when people used to go out for that, was you were the first Monday after Thanksgiving, going out for typical buck season here in Western Pennsylvania. And I mean, the ticks were already on the deer, and they were already completing their life cycle. So what happens after the nymphs infect us, and notice when people go hiking in the summer, look at the clothing they're wearing that are there. Very, very exposed. They grow into the adult size, they mate, and customarily where they mate and sort of end the males end their life cycle is here on the deer, hence the name of deer tick. So you have to understand the life cycle to understand how the disease progresses. And voila, here, as you can see here, the female is dormant, the male dies, and then we start the life cycle over again. And so the peak incidence is definitely there, and it depends seasonally on how warm or how cold it is. And they go through all this as antibiotics, relatively easy to find. To later the stage, prolonged treatment. The treatment, if it's not caught early, can last as long on antibiotics as a year. But it has to be identified. And the preventive measures are very, very similar to anything that you would have. It's protective clothing, avoiding exposure, knowing where the areas are. A lot of them are posted nowadays. I don't know if they still is available. Maybe Dr. Bat, do you know about if they still make DEET? So you can still get that. Yeah, DEET is, you want these repellents that are 100% DET. I forget what the acronym stands for. but this is the stuff to use. It's probably environmentally very unfriendly, I am sure. Okay, anecdote time. I'll give you two. During the lockdown, that summer, which I think was, it was, so that was the summer of 2020 when we were locked down. I don't know what you did when we were at home, because we were all at home around here. My wife and I, we either took very, very long walks all over our area called the Woodlands in Cranberry Township, and I see deer every morning when I walk the dog that are there, or we're working out in the garden. And so we were sitting out on the deck. It's just the two of us having something to eat. Probably in the July of that year, my wife says, it's just bothering me. I got something here. It's been bothering me for a couple of days. And she slides down the side, and right here, target rash. I said, you've got Lyme disease. No, I don't. I said, yes, you do. That's the only time you ever see that kind of, like, it was round, and I could see it starting, the next lines were starting. So off to the urgent care. I didn't get to see whoever saw her. I think it was a nurse practitioner at the urgent care up by us, over on 19 in Wexford. And because I'm sitting in the car, she comes back out. You're right, it's Lyme disease. And then she had to take 3 weeks of antibiotics. We caught it early in phase 1, no long-term problems whatsoever. So that's, we were fortunate enough to recognize it. And it's hard because thankfully it was in a more obvious place. That would have been relatively easy to see if you saw it in the mirror fairly easily. Here's my mistake. It was about 30 years ago. So it was the mid-90s, because I know which office I saw this patient in. And this is why you don't prejudge people. A busy day, and I see, and this young woman comes in, I would say mid-20s. I'm going to be kind and use the word scruffy. Not very well dressed, fairly coarse, unpleasant attitude, almost argumentative, particularly like with my office manager. I almost whispered in my ear. She goes, I think this is a drug seeker. And I thought the same thing, because I'm going to take an interview. What's going on? I've been, for the last few weeks, I've really been hurting. I can hardly move. Every time I move, it hurts. I tried to examine it, almost suddenly moving away. And I said, well, what's we go? I mean, give me an idea. Where did it start? Anything in the history? And she was it was more brusque. I said, does anything help you? Does aspirin help you? Does Tylenol? Does ibuprofen help you? She goes, no, just that Perca something stuff. I had a couple of pills of. Bing. In the back of my mind, drug seeker. But understand, and I don't know if this probably was emphasized to you, or it should have been in A&P, the common time for autoimmune diseases like rheumatoid arthritis, lupus, those kinds of things are women, the most common, 4 out of 5, typically, ages 15 through 55. So in the back of my mind, I'm suspicious, but I'm going to give her a prescription for some strong medicine. You can't give a refill. It's a class 2 controlled substance. And here's this whole series I figure I'm going to give her these blood tests. If she gets them done, then she's serious about this. And I need to see you in 2 weeks. I said, if I don't see you in 2 weeks and these blood tests aren't done, I can't help you anymore. So that was, at least I was trying to be as professional as possible. She didn't come back in 2 weeks. Aha, no. About a week later, my office manager goes, she made an appointment and she's back. They're coming today. She came in not scruffy at all. And interestingly enough, her husband was there. More interestingly, she was in a wheelchair. This is an absolutely true story. And the husband going around, and you could see she could see how much pain she was in. He and I gently lifted her out of the wheelchair to the examining table so I could examine her. And she was horrible pain. And what goes on? It just got suddenly worse. She had gone from 1 to 2 easily. And maybe she was in the middle of phase 2 by that time. But it could barely touch her. I said, tell me more about this. I mean, what's going on? And she's almost in tears. I didn't want to tell you. My husband had lost his job. We live in a trailer up in the woods. She lives, if you're familiar with northwestern Pennsylvania, she lives in Spartansburg. Spartansburg is located between Titusville and Corey. The only thing that is in that area are Amish folks and deer. Absolutely true. And so she said, all I could do, we have 3 little kids, all I can do, all we could do to have any kind of fun is I just take them for walks and we go hiking around the area. And when she started to say that, it's like all of a sudden it's really a little bell went off in my head. Go, this could be Lyme disease because I knew exactly what was there very, very well. So I see the problem. I had not done a Lyme disease titer. When I looked at the blood tests and when she had gotten them done, what we saw, okay, and I saw with some indicators there was something off in her blood count. There was little markers for inflammation were increased. There was certainly something there. I had not done Lyme disease titers. It didn't come to my mind. I was still, and that's what I mean. You get tunnel vision. So I immediately called up. We didn't even have an infectious disease specialist in that area. Oil City Franklin hospitals neither had. Meadville was the closest one. I called up the doctor. I made an appointment for her to see it. Sure enough, Lyme disease titers were positive. I saw her one more time, came back for follow-up. Yeah, a few weeks later, she was on antibiotics. He said 6 months to a year. After that, I lost her to follow-up. but my inclination was that we caught her early enough to prevent long-term damage. The moral of the story, don't do that. Okay? Don't do that. Don't have preconceived notions because they can cloud your judgment. I tell that Lyme disease story all the time, ever since I've been here teaching micro, certainly. It's absolutely true. There's some more in this PowerPoint you might find, but I want to get back to really what are the classic skin diseases that are so important. Let me just X out of this. So it's there for you to take a look at. And we ended here, and then we started viral diseases. So, I mean, who had chicken pox? You did. Do you have chicken pox? Okay. Because of the age. None of you guys had chicken pox because you're all immunized. The immunization came in 1995. Any of you have measles, mumps, German measles? You guys? That's because the MMR came out roughly, I'm going to tell you, a little earlier than that. Maybe 1980. I'm thinking 1980s, maybe even earlier than that. All of my kids had the MMR vaccine. My kids were born in 83, 84, and 86. All my kids had the chicken pox. Okay. And maybe I told you this before, my kids are not biological siblings. I have 3. The first one had the chicken pox, the classic case, high fever, 103, 104, covered in these spots. We were delighted. We wanted him to have a lot of spots. All parents did. The worse the case, the better the immunity, theoretically, up to a certain point, as I will tell you. So much so that when we had the others to take care of, we were so busy, we said, and Grandma and Grandpa said, okay, we'll take him back here in Pittsburgh area. 2 weeks to the day almost, my middle one comes out. You start to see the spots. Barely a fever, 101, didn't slow him down. Still outside running around. We were terribly disappointed. Yeah. 2 weeks later, almost to the day, my daughter, 106 fever, mind you, ended up in Oil City Hospital. Our family doctor said to us, he goes, Lou, he said, we can life flight her to Children's if you want. He said, my feeling, we'll wait one more day. We'll keep an eye on this day. If it gets any worse, we're going to life flight her. I said, okay. Finally, the fever broke. She was that sick. All the same disease. I realized they were not biological siblings. It could affect anybody. It doesn't have to present this way. That's why the immunizations were there. We used to call these things the usual childhood diseases. Measles, mumps, German measles, chickenpox. I had 3 of them. I didn't have the mumps. I got the mumps shot once they had it when we were getting married, because we were going to hopefully start a family shortly thereafter. So I had the mumps vaccine, and then that was the only one I didn't get, but the vaccine was fine. I didn't have any problems. All of these are worse as adults. Much, much worse. The childhood diseases are typically rest in bed, plenty of fluids, tincture of time, and you deal with the problems that are associated. Most of the problems with these are because they form a rash. The rashes are itchy. It's very hard to resist scratching yourself, the dirtiest part of your body, underneath your nails, filled with staph and strep, all sorts of stuff. You can't help it. When you surgically scrub your hands, this is the part that's most important to get clean. And we deal with the problems are, and the same with fungal infections, viral skin infections and fungal skin infections. The real complication is secondary bacterial infections, typically with staphylococcus or streptococcus. As you can see here, they're itchy. Fancy name is pruritus, for itchiness. This was the way they present. They start as flat macules. We talked about that the other day. They go and become papules, slightly raised. Then they become blisters, and they typically have some exudate, and they kind of dry and crust over. And by that time, now the disease is starting to relent. Probably it has a 3 to 5 day course, but the itchiness is ever. They typically start centrally and work their way out all over the place. Very itchy. What we do, our kids, when I was a kid, and my kids are all having it, you cover them with calamine lotion or Caladryl, which is calamine lotion with Benadryl, this pink stuff. And because it was so itchy at night, if you're familiar with Aveeno products, Aveeno now makes a really hypoallergenic quality skin line. In the old days, they had one product, colloidal oatmeal. And you get a bathtub and you pour these oatmeal this in, and it stopped the itching magically. And you let the kids soak and play in that overnight and get them ready for bed. So they didn't go crazy itching overnight. So what we did for all three of the kids. It's really comparatively a mild disease. It has a lot of complications in people who are unvaccinated, particularly as adults, and you'll see the same is true for measles. And German measles is a little bit different. Those are the ones we're going to get to today in the time we have left. Very severe in adults. Okay, we have the luxury in our culture, and our moms all knew about it. As kids, we got it. Okay, stay in bed, supportive care, plenty of fluids. I mean, it wasn't such a bad thing. You got to stay in bed for the next 3 to 5 days, so these stop. You can't itch or scratch. You're going to put covered in calamine lotion. Just sit and watch TV. What's wrong with this picture? I'm good with that. I mean, I don't have to go to school? No. Okay. We didn't have any of this virtual stuff. We were having a good time. Moving on. So look at all the things that can happen, particularly in the immunocompromised. My middle one was having a workup at the old children's hospital, which is down by Presby, not up where it is now in Lawrenceville. They kept him for a couple of days. They did that then. It was not so much outpatient stuff that was done because they wanted to observe what was going on for this GI workup. He was a clean case. He had no history of infection, a year and a half old. This is 40 years ago. They put him on a floor with a liver transplant patient with multiple kids who had major orthopedic reconstructive surgery because the infection, you're worried like that. If you did not know it, and this is what happened, chicken pox is extraordinarily deadly to someone who's immunocompromised. So they put him on the floor with all these people who are at risk with any kind of an infection. Sure enough, the Y up in Oil City had an outbreak of chicken pox right in the playgroups that he used to have. We immediately told them, once we got word of it, at that point, they put him in reverse isolation. They wouldn't, when they had to do studies, he would be wrapped up like a mummy. I was staying overnight. The only thing I was allowed to leave the room was to go to the bathroom that was across the hall, and I had to be all gowned and masked up. They had the exhaust fans going because the kids next door, one of them was a liver transplant kid, fresh post-op. That's how scary that can be. We're talking about chicken pox, everybody. And what happens, and this is what all of you will see if you're going into clinical fields, you don't have to worry about it. 1/3 of us statistically get shingles, and all of you have been exposed. Either you had it or you were immunized, and even if you were not immunized, there's enough of it around that you were probably exposed to it. And in some way, shape, or form, or refractory, or just an asymptomatic carrier. Once it becomes latent, remember it's a herpes virus. Varicella zoster virus. Varicella is chicken pox. Zoster is shingles. It's totally different. It's very painful. It follows the course of a sensory nerve. We don't know what brings it out. Any of these recurrences are usually associated with something that has compromised your immune system. The worst case that I saw was in a lady I treated for about 20 years, who was older at the time. She was still driving around 80 years old. Her husband was not. They were married for like 60 years. She was driving, got in a bad accident. She survived. Her husband did not. She blamed herself. She had a case here, along all the way into her eye. Couldn't comb her hair for weeks at a time. The pain at that time, before we had antivirals, was so severe. The biggest problem that I had treating patients who had lower extremity shingles was trying to keep them off the pain meds so they didn't become addicted. We didn't have Valtrex. We didn't have the aciclovirs for antivirals. All we had were pain meds and topical therapy. That was it. Very nasty, followed the course of a peripheral nerve. I had another patient, she was more in the hairline, another guy was all the way into his eyes that were there. One of our colleagues here on the faculty, I think he missed 3 weeks, to my recollection, who had an outbreak of shingles. You recall that, Dr. Badger? Dr. Buxton having it? Yeah, he missed about 3 weeks. And it's just, it was all facial. So it was quite a long time that was there. Here you can see it. We don't have to go through all of these types of things that it does. Okay. Coincides with some decline in cell-mediated immunity. What can cause it? Life changes, loss of a loved one, major events that occur, illnesses, any type of immunological thing, reactions to medications. All of those are possible. Okay. Notifiable disease, because we have the immunization for it. As you can see, we had, even in the early 90s, that many cases. And so the vaccine in 1995, now fewer than 500,000 cases, 8 deaths a year. This was about 8 years ago. So it's not, and then only for people, for whatever reason, either the vaccine, its administration, I can't really tell you. Much more significant, again, to babies born to mothers who had it early in their pregnancy. If you were exposed to someone with shingles and had not been immunized or had not had the disease before, that would, you don't pass the shingles on, it would become chickenpox. Now we have all these for treatment. Again, Rye's syndrome, avoiding aspirin. This was a classic example of it. I did not take the shingles vaccine. It reduces the risk. I didn't necessarily feel that was a sufficient reason for me to go with the vaccine that was there. Measles. Just look on any news site when there's an outbreak of measles. They won't even, just to get clicks, it'll say the most contagious disease we just had an outbreak of. They're talking about the measles. This indicates 99% of people who will have gotten the measles when they were exposed to it, assuming they were not immunized. That was absolutely true. I think I told you when we first met here about when we talked about resurgent diseases, measles and tuberculosis. In our day and age, my mom and all the other ladies in the neighborhood, I told that anecdote, they took us to the circus. They used to have measles parties and chickenpox parties. They wanted the kids to get it, and they wanted the kids to get a good dose. They'd keep them, they'd sit on them so they wouldn't do anything. They knew just how to take care of them. Boom, we'll be done and over with. Because they knew they were going to get it. We all got it. You were covered in spots. They were itchy. They looked horrible. People didn't realize that without it, in relatively healthy children, not a problem. In adults, a big problem. It's the third largest killer in sub-Saharan Africa. So in the African subcontinent, below the areas along the Mediterranean, malaria is number 1, AIDS number 2, 3 is malaria. 3 is measles. Why aren't they immunized? Unfortunately, and we'll go into a little bit when we talk about HIV, most likely the origin of human immunodeficiency virus, and I may have mentioned this before, was an effort to make polio vaccine on site in Equatorial Africa in what they called labs. Labs had dirt floors, and they were cultivating it in diseased monkeys. They were doing it on the cheap. There's a lot of evidence to support this. I've seen documentaries about this. Awful. So there's a tremendous amount of vaccine distrust. That's why. Because the MMR has got a very good track record vaccine-wise. So it's not one that people should be frightened of. Well, I don't know of any particular complication rate the way I've studied and looked at these type of things. So we no longer see it endemic here. Okay, but this is vaccine laxity. There's no two ways about it. This is what it's about. It starts relatively innocently enough. Incubation period. It's so easy to spread. It just spread like wildfire. All the kids in the neighborhood got it at the same time. The rash lasts about a week. In healthy, earaches, very rare complications about that, but not so in areas with less health care, where children would have the kind of be able to stay at home. It's a different environment when you're talking about poor countries with minimal health care that are there. This is a relatively rare complication. Something in that virus has altered brain tissue and over time creates this kind of encephalitis. All of these things are true about it. Paramyxovirus, mumps is in the same category. That's in there. RSV is in the same category. This is also spread respiratorily, like chicken pox, like German measles, which is in a different category. Okay, respiratory route. This is one of the reasons doctors were always looking in people's mouths, because of these little coptic spots. They look like kind of coarse salt granules when you push the tongue away. It's sort of like in the inner cheek, deep inside, across from the molar area. Okay, a very limited amount fatalities called rubeola because they were ruby red, where German measles is rubella that were there. Human to human, prior to vaccination, probably less than 1%. That's why it's the most contagious infectious disease that we are aware of. Notice here, 20 years after the immunization, 115,000 people died globally, mostly children. Very sad. Go through some of this and you can look through those. And lastly, rubella. Called the 3-day measles. I don't know why we call it the German measles. I've always wondered, but it just kind of stuck. The real problem with rubella is the damage to the unborn child. It is relatively minor. I had it as a kid. I can still remember to this day my preauricular lymph nodes here, bumps that felt like golf balls, super sore. Don't do what I do. I got it right, like in the spring of right before prom, and you couldn't miss the day at school, or you couldn't go to the prom. And I had maybe 101, 102 fever, and I got called out for being an idiot, and it was absolutely right, because we had driver's ed. I was in a car, and I didn't know the two gals in the car. The one gal who lived relatively close to where I lived, a couple of blocks away, she goes, "I heard you had German measles. You should have never gotten in the car." And I knew I had something going on. I didn't know it was German measles, because she had an older sister. I didn't even know that, who was pregnant. If I had known better, and I'd even thought about that, I should never have done that. I shouldn't have gone to school. So that's one of those reasons. So, and we all do those things. So it's a selfish reason, and thankfully nothing happened to that gal's sister. When I was a kid in school back then, we always had kids who had hearing aids, who went to speech class. Every class that we were in, somebody in our class had a hearing aid, somebody had to leave to go for speech classes, some other type of treatment because of this. Relatively minor, easy to spread. It's very contagious before you're sick. Okay, significant threat, and almost all of the time it involves the nervous system. You take a look, it's a toga virus, because we looked at that in viruses previously. Very easy immunological complexes typically relate to this relatively minor rash, very faint, crosses the placental barrier, and that's the damage to the unborn child. Number one in the hit parade, deafness. There are some significant syndromes in very severe cases, but this is typically this. And they talk about something called the rubella bulge. This was, as you can see, this was a 1964 epidemic. This isn't the one I was talking about. So when I was in grade school and every day, the kids in 1964 would have been entering grade school. I was probably getting around to getting out of high school. I graduated high school in 1969. So you get an idea. These were mostly 5-year-olds just entering the system, but we had plenty of them as well. Okay, 10 to 15% of people reach adulthood without being infected. That means the better part of 90% of the people got this. That's why we call them the usual childhood diseases. Occasionally there are viral spikes that were there. And you can see every so often we'll see some of these spikes occur statistically. And that's everything for today. We're going to look at these. Remember, we'll talk about this next time we meet, why we call fifth disease. This was the early days before they really knew the distinction between bacteria and viruses. We gave them numbers. Thank you very much. Have a great rest of your day. Bye.
Thank you.